Hi, everybody, and welcome back to EBNet Stream. Today, we're going to have a very, very important discussion around healthcare and the important role that the healthcare intermediaries play in South Africa. Based on an article that Trevor wrote for us a couple of weeks back, I thought I'd have a cup of coffee with him this morning and chat to him about some of the intricacies of his thoughts in that article. So joining us today, we have Trevor Schoonraad from Axiomatic Consultants. Axiomatic Consultants is a healthcare intermediary with years of experience in guiding employers and employees through the complexities of medical aid schemes. Trevor, welcome to EBNet Stream.
Well, thank you very much, Natalie. Thank you for having me. I'm excited to share some light on why brokers play such a vital role in the healthcare decisions.
Lovely, lovely. Let's start with the basics. So forgive my question, this is not an industry that I'm terribly familiar with. So what exactly does a healthcare broker do?
I think, Natalie, simply put, is we help individuals and businesses navigate the complex world of healthcare benefits. I mean, for employers, we find cost-effective solutions, we ensure compliance and assist the employees with their healthcare goals. For employers, we provide personalized advice, we help with claims queries, we ensure that they get the most from their medical aid or even their medical insurance.
Am I right in saying that a healthcare broker would be equivalent to an employee benefits consultant or an investment manager, or not manager, an investment consultant?
Yes, certainly. I mean, our focus area would be the healthcare portfolio within the employer group to ensure that they effectively spend their money to reach their healthcare goals on an annual basis. So certainly we can be put in the same stable as your employee benefit consultant and investment consultants for your funds.
Perfect, perfect. So most people assume that brokers just sell medical aid. What you've said is a little bit more than that. Perhaps you want to take us through some of the details of your day-to-day.
I think it's not just a sales-driven industry, it's certainly more of an advisory industry where we analyze different medical schemes and insurers, we compare benefits, we offer unbiased guidance to our members as well as our employer groups. We also continue supporting members once they've signed up, which is a crucial part of the job in terms of ensuring that members are aware of what their benefits are so that they can get the best value out of their medical scheme.
I need to give my broker a call. So I will be honest, I never realized that these were individuals who we could phone and they could offer us expert advice and guidance in terms of our options. I get this renewal letter every year. It's got a whole pile of technical stuff in it, and it's quite intimidating. So it's lovely to know that there is somebody out there who can help us with these questions. I think that brings me to my next question. What value or why is having a broker important for a business offering medical aid benefits to employees?
I think that if we look at the healthcare, is one of the biggest employee benefits, certainly one of the most expensive and also the most complicated. We help employers manage that cost, choose the right solution, and ensure that their employees understand their benefits. This leads to a more caring culture, healthier, and hopefully a more productive and engaging employees.
Sure, and mental well-being and care is definitely the subject of the day, right? So anything that can support your employees in terms of these, I'm going to call them valued benefits. I think retirement fund benefits members think about or employees think about as being 40 years from now, whereas medical aid cover and benefits is something that we use on a day-to-day. We go into the pharmacy, we go into the doctor, we go into whatever specialists we may need. And so it's lovely to know that there is this resource available to us. And this brings me to a thought I had while you were talking. Is there an opportunity for me to deal directly with the medical scheme? I'm not going to lie. When I've had queries in the past, I phone a call center, which is quite impersonal and difficult to get hold of the right person. But should I rather be contacting my broker instead of dealing directly with the medical scheme?
I think, Natalie, one of our core focuses are definitely the servicing approach for our clients, that if it is a simple communication between you and your medical scheme, that you want to know if a claim has been resolved and you don't understand the terminology. You phone your medical scheme, they come with DSPs and all these abbreviations, where we pride ourselves on simplifying that jargon for the member at the end of the day, that if you're uncertain about if my medical scheme paid the claim correctly, or if I have a co-payment or a short payment, did the medical scheme treat me fairly? And we can certainly analyze that, look at that claim, and even lodge a complaint on behalf of the member with the medical scheme if we feel that they treated them unfairly, and even go as far as to lodging a complaint with the Council of Medical Schemes if we certainly think that the medical scheme didn't act within the rules of the medical scheme.
So someone really in my corner looking out for me.
Certainly.
It sounds amazing. And immediately my mind goes to costs. Would I have to pay extra, or as an employer, would I pay extra if I were to use an intermediary or broker like yourselves?
No, I think I'm the only guy in the room that works for free, because at the end of the day, the medical scheme premiums are the same whether you use a broker or not. The Council of Medical Schemes sets broker commission at 3% of the monthly premium, up to a maximum this year now of 121 Rand 84 plus VAT, whatever that's going to be in the near future. But if you don't use your broker, that money stays within the scheme. So you don't get a discount due to the community rating structures that we see within medical schemes. And certainly, like I say, if you use a broker or not, your contribution is exactly the same.
So I just want to touch on something you said there. The commission stays within the scheme. That doesn't mean within my savings account or medical savings account that I have in the scheme. That means it stays with the medical aid provider. Is that right?
Yes, correct.
Wow. Okay. So employees are actually already paying for this broker service, whether they use it or not.
Correct.
Okay, there's one topic I want to get into today, and that is NHI. As I said to you before we started recording this session, NHI for me, and I'll just be honest here, seems quite scary. And it seems scary from the point of view that I have a private medical aid. I'm able to go to any hospital and enjoy a level of care or medical care. I hear about NHI and I get worried, right? I think, okay, am I now going to end up in a hospital that's far away from me, for example? So how is NHI going to affect private medical schemes and brokers?
I think NHI is certainly the elephant in the room, Natalie. MHI aims to provide universal healthcare, but there's still so many unanswered questions, especially around the regulations, what type of benefits will be covered eventually when we do see the full implementation of NHI. Private medical schemes might be restricted in what they can offer once the NHI is fully implemented, which could impact both businesses and individuals who may still rely on private healthcare for quality and speed maybe at that stage. But it is still so uncertain as in terms of what the full implementation of NHI will look like.
How, if you had to say, if we're to say from a scale of 1 to 10, 10 being it's going to happen tomorrow, and 1 being it's still far away, how far are we away from NHI?
I think if 10 is tomorrow, can we go into the minuses? Because certainly if we look at where we are in the process, it is still a couple of years away. And unfortunately, I can't predict the timeline, but certainly not tomorrow or in the next 1 or 2 years.
I'm asking that because after the budget speech, the Minister of Health was grabbed by one of the what do you call them, journalists, and he said, no, we'll talk about NHI in a different interview. And I thought, what's going on there?
Yes, but I mean, certainly when we look at the budget speech this year, the medical tax credit still forms part of the budget. So we can certainly see an indication that government has got no immediate priority to get rid of the medical schemes quite yet.
Right. Under this NHI structure, will brokers and intermediaries still be relevant?
I think absolutely. If anything, people will need even more guidance to understand what NHI covers or what private options still remain in the market and how to adapt to the changing healthcare system. We'll continue to advise employers and employees on the best available solutions at that stage.
Look, NHI and national health and national health benefits, I should say, is a lofty ideal, and it's certainly something I support. The question is, can we do it effectively with proper governance structures? And I think that's the concern. So what are you telling your clients when they ask you, "Hey, Trevor, what do you think of NHI?"
I think when we look at NHI in terms of the funding of NHI, which I think is the big question mark at this stage, is certainly for employer groups that don't have any healthcare benefits, maybe to start introducing some form of benefits to have their employees get used to the process of contributing to the healthcare fund instead of just remaining uninsured. That is the angle that we're taking in terms of the guidance, that without regulations, we can't give advice yet. But certainly in preparation for something, the costs, the entry into the insurers is obviously a big barrier, and it's really just guiding those employers to start putting in policies to ensure that their employees are adequately covered, maybe in the healthcare sector, and that can be adapted once NHI is fully implemented.
Before we wrap up, I want to touch on that support to employers. What advice would you be giving employers and employees, I suppose, around their healthcare choices?
I think, Natalie, for employers, very importantly, to review their healthcare goals. Every employer should have a healthcare goal that they are working towards for the benefit of their employees, and review that on a regular basis, ensure that it still meets not just the employer's needs, but as well as their team and their employees. A broker can help employees employers to optimize the costs without compromising quality of care. For the employees, don't just choose a medical aid blindly. I joked earlier on, Natalie, where you said you received this brochure from the medical scheme. It's probably more than 48 pages, and human nature is you page to the last page, you look at the cheapest cost, and you select that option. What might work for your colleague might not work for you. It's not a one shoe fits all. Please consult with a broker, ask the questions to make an informed decision about your health. And that's not important. That is very important when you originally take out a medical scheme, but certainly review that on an annual basis. Towards the end of the year, we get overwhelmed with information from the industry and the service providers about what's changing for the following year, because that does give you the opportunity to review your current situation, to exercise your right to change your option to ensure that you meet your healthcare goals for the following year. Of course, your circumstances change on an annual basis, so please ensure that you review those annually going forward.
Trevor, it's been a pleasure chatting to you. And I think from my own perspective, as you were talking there, I was thinking, why don't I review my healthcare or my medical aid option every year? And it really comes from a place of fear. It comes from a place of fear that I've got all these benefits that I may or may not be using, lots I don't use, but I don't want to give anything up in case something happens next year.
No, certainly, and actually, I'm always happy to help businesses and individuals to find the best healthcare solution, to understand your benefits, to focus on reaching your healthcare goals on an annual basis. And thank you so much for having me.
It's been a pleasure. Thank you, Trevor. I'm sure we'll be chatting again soon. Thank you for taking the time.
Thank you so much, Natalie. Looking forward to the next session.